Hey guys, this is Dr. Hub. Today we look at the effects. So we are focusing on the effects of the opioid and on its various receptors So to begin with, we look at the mu receptors. So we are focusing on the mu. So mu receptors. So mu receptors, what is the IUPACR name? So the name will be MOP. So what is the analgesia? So analgesia, it includes the supraspinal and the spine. So it includes the supraspinal as well as it includes the spinal. Next, we look at the cardiovascular. Under cardiovascular, it causes the bradycardia. So this is the mu. Mu causes the bradycardia. Then moving on, we look at respiratory. So under respiratory, so we already saw mu has a bradycardia and respiratory will cause depression. So there is depression under the respiratory side. So what about the CNS findings? Under the CNS findings, there is presence of euphoria. So under CNS, there can be euphoria, there can be sedation. Next, there is also the prolactin release. There is prolactin, this is all in case of the mu receptors. So prolactin release is also present. Then there's mild hypothermia. There is mild hypothermia. Then comes the catalepsy. Then is indifference to the environmental stimulus. So there is indifferent. This is to the environmental stimulus. So we saw euphoria, sedation, prolactin release, mild hypothermia, catalepsy, and indifferent towards the environmental stimulus. This is about the CNS. Then when you are looking at the pupil, this is only about the mu receptor. The pupil will be meiosis. Meiosis refers to the pinpoint pupil. Next, when we look at the gastrointestinal. So in terms of gastrointestinal, there is an inhibition. There is an inhibition to the peristalsis. So inhibition to the peristalsis as well as nausea and vomiting. Now when you're looking at the GU, there is a genitourinary. So here there is the urinary retention. Now when you look at the pruritus, there will be that is there is pruritus which is present. So what about the physical dependence? The physical dependence will be there is physical dependence. And it doesn't show a significant anti-shivering. So what about anti-shivering? There is insignificant evidence. Next we move on to the kappa shivering. Kappa receptors. So to begin with kappa, the IUPACR name. So this is nothing but the KOP. So to start off with analgesia, it has a supraspinal as well as spinal. So there is supraspinal as well as there is spinal. Then we move on to, there is no significant in case of cardiovascular and respiratory. So we move on to the CNS. In CNS, it includes sedation, then dysphoria. Next, there is also the psychomimetic. There is psychomimetic reactions. And it also includes the hallucinations and delirium. So it includes the hallucinations as well as the delirium. So next we will comment on the pupil. So how does the pupil look? So if you look at the pupil, it causes the meiosis. In terms of pupil, there is the meiosis. So again, when you look at the gastrointestinal, it is nothing significant. So next we move on to the genitourinary. In genitourinary, it causes the diuresis. So diuresis, it causes the inhibition of the vasopressin release. So it's inhibition of vasopressin release. And the pruritus, it is nothing significant. In case of the physical dependence, PD, it is low abuse potential. There is low abuse potential. So what about anti-shivering? So comparing the mu, kappa and delta receptors, anti-shivering is present in the kappa receptors. So the answer is a big yes. So anti-shivering is present in which receptor? It is the kappa receptors. Then we move on to the delta. So the delta. So in terms of the delta receptor, the IUPACR name is the TOP. So how is the analgesia? The analgesia, it is supraspinous as well as spinal, and it modulates the mu receptor activity. So it modulates the mu receptor. It modulates the mu receptor activity. So here the cardiovascular, respiratory, CNS and pupil as well as the gastrointestinal are not significant. So we move on to the genitourinary. So in terms of genitourinary, there is a urinary retention which is seen. There is a urinary retention. So what about the pruritus? So the pruritus, answer is yes, the pruritus is seen. Then comes the physical dependence. So how is the physical dependence? So if we look at the physical dependence, the answer is yes, there is presence of physical dependence. So this was about the effects of opioids on its various receptors. To learn and grow daily like this, please do subscribe.